Thank you all for coming. I'm Keith Schmitz, and on behalf of the Grassroots North Shore Steering Committee, we'd like to welcome you and appreciate the fact that you're coming by to find out more about this important issue of healthcare. As you know, we have a ridiculous healthcare system in this country. We spend the most and we get the worst outcomes of any country in the industrial world. And this is something that we've been fighting for a long time. And one of the people who's been on the forefront of this fight has been Dr. Robert Kraig. He, in fact, was present at the birth of the Affordable Care Act back in 2009. Robert has been the executive director of Citizen Action of Wisconsin for the past 11 years, and this is a very Citizen Action, in case you don't know, is a very valuable component of our progressive infrastructure in this state. They've been doing great organization around healthcare and also around communications, which of course is Robert's specialty. We've been doing things with radio, and there's been co-ops that have been set up to organize all across the state. So we're very happy to have Robert here to talk about what could happen and what we'd like to see happening in terms of healthcare reform and what the 200 presidential candidates have in mind for it. So I'd like to present Dr. Robert Kraig.
Good afternoon, everyone. Thank you, Pastor Ellen, for hosting us here and hosting us tomorrow at the Badger Care Expansion Rally at noon. And thank you, Grassroots North Shore, and Shirley especially, for all your work on this and for talking me into it, as you always succeed in doing, whatever it is. And so Karen Kirsch, our Healthcare for All co-op organizer, is right here, and you can connect with her about the rally tomorrow at noon right here. Because as you folks all know, taking that Medicaid expansion money that would allow us to make more people eligible for Badger Care is the biggest controversy in the state budget. And there are others too, and we very much need Tony Evers, even if he feels like strategically he has to accept large parts of this Robin Vos budget, to veto the Medicaid part of the budget so that we stop turning down hundreds of millions of dollars to extend coverage to more people, more working people who don't get good insurance at work. And so in addition, if you have a healthcare story, Dan Folkman here, who is filming this, will also film you so that we can use it in the broader healthcare campaign, because we're working for Medicare for All, Badger Care expansion, and a lot of other things in between in order to finally get the kind of healthcare system everyone in the United States deserves, quite frankly. So what I'm going to try to do here is, and you'll have Dan's video of this, it'll be on the Grassroots North Shore, and I think we'll put it on the Citizen Action of Wisconsin website as well and social media, is to, in a half an hour, tell you everything you need to know about the debate over Medicare for All, so that you can make decisions about the presidential election and about what we might see if we get a president elected on it in 2021, which of course presupposes the current president will be a one-term president. But remember, healthcare was by far the top issue in 2018 election. It not only cost Scott Walker a third term, it also led to a Democratic House of Representatives. We at Citizen Action Wisconsin were kind of a voice in the wilderness in that we thought this was a great electoral issue in 2010, in 2012, in 2014. A lot of mainline Democrats said it wasn't and ran away from it. We thought pre-existing condition discrimination was the wedge issue that stood in for all the rest, that explained how unethical our healthcare system is, since you can just, when you need healthcare most, suddenly be thrown off your coverage and be left in a situation where you don't have life-saving care and you're bankrupted and you lose your life savings, right? And that was the dominant issue, as I said, in the governor's race, in the U.S. Senate race, where Tammy Baldwin was overwhelmingly reelected against a well-funded candidate running on Medicare for All. She's been for that all her career. because of her own life experiences, and then also in the House of Representatives. So Democrats need to make good on this. That's why Tony Evers, by the way, needs to veto the Medicaid budget, not give in to the Walker position on turning down $1.1 billion and counting to provide more affordable health care, which is just stunning. So for Medicare for All, really there's been a turn, right? After the Clinton healthcare debacle, you could call it, in the early 90s, it's a debacle in that they got nothing and it led to a right-wing backlash in Newt Gingrich. And then years, almost a decade and a half of Democrats not wanting to touch comprehensive reform, we in Wisconsin started to reinstigate that. People remember Healthy Wisconsin, which was Wisconsin's own homegrown single-payer plan. We were very involved in that. The U.S. Senate, the state Senate, the Wisconsin State Senate, led at that time by a nurse, the first Senate Majority Leader, who was a woman, Judy Robson, passed it, but did not have support either from the then Democratic governor or the then Republican House, but it held up the budget into the fall in 2007 and helped with one of the things that helped set the preconditions for the Affordable Care Act debate. The Affordable Care Act was structured to avoid the problems with what happened with Clinton health care, where there was this huge backlash. So it attempted to create a better system for everyone left out of the current system while not so fundamentally restructuring the current system, Medicare, Medicaid, and employer-based health care, that it led to a big backlash, right? And that it didn't offend all of the interests in the healthcare industry. And so that was the grand bargain. We know that was a huge step forward. We know, unfortunately, despite President Obama deciding to include a lot of Republican ideas in it, including these health insurance exchanges, once it was his policy, they kind of blew a partisan dog whistle, and you weren't a good Republican if you weren't against it, regardless of your previous positions. And that's been this huge partisan issue. As a decision of the Republican Party, President Obama set it up trying not to be a partisan issue and trying to get crossover support. Now, part of the reason we're even doing this, having this complicated system, part of the problem with the Affordable Care Act was its complexity, right, is because we developed a very complicated, more private system than other advanced industrial countries after World War II. We can talk about in Q&A, there are a lot of complex reasons for that. But when Great Britain was creating a national health system where the doctors were literally employees of the government in Great Britain, and when Canada and others are moving towards at least the coverage system, the insurance being social insurance, like Medicare or Social Security, we were doing it through employers. And at the time, we had a heavily unionized workforce, very strong unions, and it became the mark of what a good job was, to have a pension, to have health care at work, and to have a good job with a living wage and union protection. And quite frankly, health care was way cheaper then. We didn't have all the technology and all the cost. So it was really like, it wouldn't have been any more expensive now than dental insurance is, right, for an employer, which isn't nearly as expensive, or probably even less than that. But it built up in that way, and it built up tax-free because of very important decisions made at that point. And that created a very big private system of insurers, the pharmaceutical industry, the medical device manufacturers, and nonprofit mostly, though there are some for-profit hospital systems that built up really without any government planning per se, right, a little bit. Medicare and Medicaid were the first big expansions, and Medicare you had to do because guess what? Why would insurance companies want to insure seniors? Because what do seniors have? What is a condition of aging? Pre-existing conditions. And so most seniors were uninsured, 2/3 of them, because insurance companies wouldn't insure them or wouldn't charge them a rate they could afford. And so you had to have Medicare, which is the beginning of the first Medicare for all single-payer style system in the United States. But we did it differently for Medicaid, which was a mistake probably. It would be better to put them together. But Johnson made huge progress. Those were two of the great advances in social and racial justice of the whole 20th century were Medicare and Medicaid, and they were built on over the years. And Medicaid became a larger and larger system. In fact, in Wisconsin, even Republicans like Tommy Thompson expanded it dramatically, expanded Badger Care, said you needed Badger Care in order to make work pay. That was Tommy Thompson. Now looking at Robin Voss, right? Someone should go back and take some quotes from Tommy Thompson about Badger Care and compare them to what Robin Voss is saying right now about it. But we got this piecemeal system that was built up, and one of the problems was we got a lot of good things out of it. I don't want to be completely glass half empty. We have a lot of great medical professionals. We have a lot of incredible technology. We have a lot of different things that have been built up. When you go into a hospital, the kind of things they have available are just amazing, right? So we did a lot, but you know, the other advanced industrial countries have those things as well, and they pay half the amount per person. So, and they do that while covering everyone, which we don't do. And so the system, and as it gets more and more expensive, it's more and more unsustainable. It has eaten up anything that was left of wage increases. People aren't fully aware that employers are actually keeping wages low to pay for the huge health insurance cost increase every year. I can tell you it's a stress on an organization like Citizen Action Wisconsin. We provide a good health plan. It is $40,000 more than it was 3 years ago for covering the same amount of people if you adjust for the number of employees. And we expect that to be $40,000 more the next year and in next 3 years. And so that affects our bottom line and our ability to how much staff we can hire, and also you know, what wages we pay good wages, but it's obviously cutting into our capacity to raise them even more than we have. And so that's affecting writ large the whole economy. So the big switch that occurred here in 2016, Bernie Sanders deserves a great deal of credit. Bernie Sanders simply ran on Medicare for All, a single-payer version of Medicare for All, where the government would, like Medicare, would be the payer, right? And you wouldn't have private insurance. And he did very well in that primary, in the 2016 primary. And there's a simplicity to it that the Affordable Care Act didn't have. It's simply, you'll all have a Medicare-like system improved with a lot of the holes filled in so you don't have to buy gap coverage, right? And more essential benefits covered. There are problems. The Medicare system we've set up doesn't cover everything as it should, doesn't cover nearly as much as Medicaid. So all the plans out there fix that. And some of them go further and actually include long-term care, which I'll get to. But on that simplicity, it caught fire. And so now, fast forward to 2018 I told you about, and how that election, right, was about health care. We now have a lot of candidates running on Medicare for All. Now, one thing you may be asking for yourself is, do they all mean the same thing? And the answer is no, actually. And it's partly grounded in where the public is. The public doesn't take Medicare for All necessarily to be the Canadian single-payer healthcare system. That's, now progressive activists do because we're wonky, right? And we study this stuff, but for the general public, it doesn't take it that way necessarily. Some of it does, some of it doesn't. A lot of it doesn't. A high percentage of the public thinks you can keep your own private health insurance system, coverage at work under Medicare for All, when of course, if it's single payer, you can't. So what I want to suggest to you is that the word, the definitions of it are ambiguous. Quite frankly, and pliable in a lot of ways. So progressive activists who have wanted single payer for years, and groups like the Physicians for National Health Plan, which is a close ally of ours, take it as, National Nurses Union is another, that therefore there's a commitment in the public to single payer. And therefore they want to use that in order to actually pass a single payer plan very quickly. And that's what is in Bernie Sanders' campaign for this election, 2020, and it's in two bills in the Congress. Bernie Sanders, his health care plan, his Medicare for All plan, and the House plan that is by Pramila Jayapal, who's co-chair of the Democratic, the Progressive Caucus in the House, and also actually is a former head of a Citizen Action-like organization in Washington State that's part of the same national network, People's Action. So she's entirely from our world. In fact, I got to attend the first ever hearing on Medicare for All in the U.S. Congress. That was the last day of April, because I was in town for the People's Action National Convention. I got one of the very few seats. Now, why were there few seats? Because Speaker Pelosi's people put us in the smallest hearing room in the whole Capitol. So you literally had, people were just packed into it, and journalists with cameras were sitting on our laps, literally, trying to film it, et cetera. And now there have been two more hearings since then in two other committees. And so that is very exciting. Those are bills that go very rapidly to a Canadian-style system. The Pramila Jayapal bill does it in 2 years. And Bernie's bill does it slower in about 8 years in big chunks. But they outlaw private insurance, and they create an improved Medicare for All system. They both include long-term care. Now, what's interesting, everyone noticed the controversy that has occurred around another candidate, Kamala Harris, the senator from California, where she said in her announcement that she would eliminate private insurance, and then there was all this backlash over that to some degree, and then she reversed herself and said she wouldn't get rid of private insurance, where this is a very intelligent person, the former Attorney General of California, didn't fully know that what a lot of the public took to be Medicare for All was not banning their private insurance, even though people, as it's used in progressive circles, that's what it means. And so, interestingly enough, what the general public, not the activists, I'm talking about, and in fact, there's really good polling now that looks at activists versus progressives or Democrats generally. So you got to pull out the people who, like, are members of Grassroots North Shore, Citizen Action, as a distinct group that in some ways is far better informed, more involved, and therefore has different opinions than just relatively disengaged voters. Still engaged by American standards, but not as engaged as people in this room are. And so they seem to mean by it this, that the government's going to guarantee I have affordable health care no matter what, and it's a right. And so the whole turn here is about making health care right, not just trying to improve around the edges. And that's what Bernie Sanders did in 2016, and that's fundamental. So make it a right, make it the government's job to make sure you have it, but also let you keep what you have now if you want. So they don't think through if that's viable, if you can have an employer-based coverage with private insurance and them not, siphon off just the healthy people and dump everyone who has health conditions onto the public, et cetera. They're not thinking about that. They're just saying they'd like it all, right? They'd like choice, and they'd like to stay where they are until it doesn't work and then have this other option, right? So what they're talking about really is kind of a public option. That is the general disengaged public. Now, public option is something that is even broader in terms of possible meaning than Medicare for All. You all remember public option was the last big progressive thing that got taken out of the Affordable Care Act, and there was a lot of hope that if you had a Medicare-like plan on the exchanges, then it would keep everyone honest, right? It would keep the insurance companies honest, it would keep the hospitals and the other providers and the specialists honest, et cetera. And then it was taken out because Joe Lieberman wouldn't vote for it, for example, and he was from a state that basically everyone knows what the chief industry of the state of Connecticut is, right? It's insurance, right? Yes. And so therefore we didn't get it. One thing people are less aware of, even activists, is that the public option version at the end wasn't a public option worth having. It didn't even have the ability to negotiate prices, let alone set the price. Medicare sets the price. It has a very comprehensive system where it figures out what the price should be in each area, adjusted, and for each kind of procedure based on what professionals will be involved and what their cost should be, but it sets the price. Medicaid does the same thing, somewhat less expertly, because Medicaid pays a lower price, so much that's often a controversy, than Medicare does. But if you can't set the price, you're just a public version of an insurance company. Okay, now insurance companies could use their leverage to negotiate. One reason they don't is they actually have less leverage than the big health systems that have been conglomerated, your Auroras and your Ascensions, for example, in southeast Wisconsin. The other reason is they don't even actually have an incentive because they just get a bigger cut of a higher amount. So for them, as long as they're more than happy to pass the rate increases on the price of medical care, medical services down, and then take the same percentage cut, which also goes up automatically, right? So they're not even incentivized to do it, even if they want to negotiate. So there are other public options, though, that would either negotiate or would even actually set the price, like Medicare. And really the problem is the price, just so everyone knows. There's very good research on this. A third of all spending in the United States, medical spending, is not value-added, it's waste. It's the administration to go after claims on the medical side. It's the claim denial and apparatus on the insurance side. It's all the different insurers so doctors and hospitals have to have all these different administrators just to get paid, right, for the services. That's all very expensive. But the prices go up without really because the prices are not transparent Just so you know, only about 13% of medical services are even shoppable, according to the best research, but they're all over the map. I mean, the same hospital will charge one half for one kind of procedure than the other side of town or the other system, and then double for something else. It's just all over the map. You know the stereotypical Persian rug bazaar where you never know the price. You know the price a lot better in a Persian rug bazaar than you do in medical services. You at least finally get a price offer. May take a while, right? When you like a rug and you can walk down to the next, seller of Persian rugs. That's not the case in medical services at all. No one knows the price, and it's not related to the cost. There's good research that says that the price is not related to cost. Okay, it's related to what the market will bear, where you can get more or less, and what the strategy of each hospital system is, or each provider group is, period. So the reason, for example, we have surprise medical bills for anesthesiologists is the one that everyone hears about, is because a lot of anesthesiologists decided it's in their interest not to be in network, so they can charge that higher rate. And it's in their interest for you not to know that until after you've already gotten the service, even though it occurred at an in-network hospital with everyone else in the system, the doctor, the nurse, everyone else being in network. So you have a lot of that going on in the whole system. Elizabeth Rosenthal's book, American Sickness, is a fantastic book that lays out how profit motive and how much to make is baked into the entire system. And you will not deal with that if you nibble around the edges, and if you don't deal with price, you won't deal with affordability, you won't deal with access, and you won't make it a fundamental right. So we have to do this. Now, what I want to say to you is that there are some public options not worth having. There are some candidates for president where it's unclear how good their public option is. But there are also public options that are so strong, they would over time, in my opinion, put private health insurance out of business, but it would take a little longer, and people would still have choice, so it wouldn't be the government outlawing private insurance or taking people's insurance away right away, which is what foments the biggest backlash. And the reason is this. If people are interested, there's been an incredible amount of behavioral research around what makes people tick and how they think about things. And Daniel Kahneman and Amos Tversky won Nobel Prize. Kahneman did. Tversky had passed away before Kahneman got the Nobel Prize, about how people actually think. It totally upended economics, because economics is based on classroom models on a chalkboard of how markets and people make decisions, which aren't based in any actual behavioral research whatsoever and aren't true. But one of the things Kahneman and Tversky found is that humans are incredibly loss averse or risk averse, and will overrate the cost of loss well over what a gain could be. And the result of that, when you combine that with healthcare, where it's deeply personal, where it's life and death, right, is that people in general want the system to change. This is what happened to Clinton Care, and this is what happened to the Affordable Care Act to a big degree as well. So therefore, they support changing it. But once you put a plan in front of them, it's very easy to make them very afraid that it'll be worse than what they have, and they're very worried about the loss of what they have because it's so important to them, right? Because most people are still covered. And it's a panic where they literally won't do it. And if you add to that the hundreds of millions of dollars the pharmaceutical industry, the insurance industry, some provider groups, some parts of the AMA have at stake in the system. I just heard an anti-Medicare for All ad on Meet the Press this morning. There's something called the Partnership for Americans Health is being funded by hospitals, by insurance, and by pharma and medical device, and they're running big ad campaign right now saying the government will make all your healthcare decisions, right? Which is a terrifying thing to people because people want control of their healthcare decisions. It's fundamental. That's what the research shows. And so it will be very hard to do something like Pramila Jayapal's bill, where we literally, and by the way, never mind the Senate filibuster, okay, where we literally take something away from people right away, particularly once they focus on it happening and focus on the plan. It may work in the election. Now, I'm going to tell you it's important to keep it for the election, but we then have to figure out the reality of what we can possibly pass, even in the best case scenario, a progressive president, a progressive Senate, and a progressive House of Representatives, and win, right? And how big a step we can make, and whether we can make a step that will lead to further steps. Because what we can't have, and this is a big failing in President Obama, way too much of a claim that we'd fixed everything with the ACA and there was nothing more to do. It really should have been set up as a step, a big step, but not the last step, and we need to do that again this time. So the bill I want to recommend to you that might actually be the best way to manage this risk aversion and where people actually are on health care is the Medicare for America bill. So the Medicare for America bill is by Roseanne DeLauro and by Jan Schakowsky, two congresswomen, very progressive congresswomen. What it does is it literally says that everyone will have access to Medicare, that employers can buy in, that individuals can choose it instead of their employer-based plan, that Medicaid will become this system, so there won't be separate state Medicaid programs anymore like Badger Care. And by the way, it's entirely paid for because it's paid for with the tax breaks for Trump Care. By the way, the Medicare for All bills are not paid for. They have no financing mechanism whatsoever. They leave that out. And we had a meeting with Congresswoman Gwen Moore, and she's very concerned about that as a member of the Ways and Means Committee. Well, the Medicare bill is paid for. The states are asked to keep paying what they pay for Medicaid. It's called maintenance of efforts. You take that money, and in addition, employers, if they want to buy in, can buy in at 8% of payroll. So you capture that, which is way less than they pay now for private insurance, but if they want to keep their private insurance, they can. If they want to pay double, they have the right to do so. It's just a matter of why would you? Maybe your hobby, remember Hobby Barn? Was that the name of it? The one that had the case against the ACA because they said they wanted to restrict the healthcare choices of their women, Hobby Lobby. And so Hobby Lobby can pay double or triple if it wants and have its own private insurance provider. That's fine, right? It'd be their choice. Now, of course, their employees could choose to buy Medicare for All on their own in this program. It has way better subsidies to afford it if you don't have an employer than the ACA, much richer, and it goes to 600% of poverty, 6 times the poverty rate instead of 4. It fills in all the holes in Medicare, and it includes long-term care. So this is a radical plan, but it's not mandated Medicare for all. It would, in my opinion, eventually, Medicare for All is so much better, kill private insurance over time, but it doesn't outlaw it. Do you see what I mean? And so that's the idea. Now, the problem is this with it. Most bills in Congress are, when are bills in Congress the strongest? They're strongest in Congress when they get introduced and they get watered down in the process, right? Then they get watered down by all of the industry pressure once passed through the capture of the regulatory state, which happens. So the question is, for Medicare for America, would it stay as strong as it is? Because if it got watered down and you couldn't negotiate the rates or set the price like Medicare, then it wouldn't save money. And it wouldn't be affordable. If you started cheapening on the benefits and creating various loopholes, it wouldn't be nearly as good. And so the real question with Medicare for America is not whether passing it as written would be a good idea, in my opinion, but whether you could pass it as written without watering it down, and whether you could hold it that good at the end of the day, after you implemented it, right? I mean, the Affordable Care Act, for example, was supposed to create mental health parity. Well, the providers and the insurance companies, especially insurance companies, have done everything they can to chip away at that. We probably don't have it now, and the insurance regulators in the states, including ours, have done very little to enforce it. We're not even sure the current administration is going to do very much to enforce it. Just to give you a heads up, the new administration. And so, in fact, Karen and I had a somewhat disturbing meeting with them that concerned us about that. Which Karen's happy to tell you about afterwards. And so we didn't get mental health parity. It got chipped away. Pre-preventive care, we're not getting it in a lot of ways. People are still paying for colonoscopies, even though having a financial disincentive to a colonoscopy kills people. We did a report right before the last vote on Badger Care expansion that showed that private insurance is charging most of the insurance companies in the state are charging very high prices for anti-opiate drugs, which is killing people. We had an opiate doctor come up at our press conference and say, people are dying if you are making it unaffordable for them to buy anti-opiate drugs, which people have to take for life, a lot of them, or they'll get addicted again. It's just like insulin for a diabetic. whereas Badger Care's copay for that is $1. Why? Because Badger Care, our state Medicaid program, is actually trying to get people the medicine they need. The insurance companies are trying to figure out how to pay less. And that's the problem with the current system, right? And of course, pharma is charging as much as possible as well. They're a huge part of the problem, right? And we have to be able to set prices on them. I forgot to mention, both the Medicare for All bills and the Medicare for America bill, they all negotiate with physician drug companies, and if they won't negotiate, set the price for them. Okay, set it. In fact, there's a really good bill by Lloyd Doggett that actually says that if you won't negotiate in good faith, it's a negotiation bill that we hope gets a vote in the House of Representatives, and if they won't, then we can take away your patent protection and open it up to any generic drug manufacturer to go into competition, which is exactly what should happen when someone is charging 5 times what they should for a medication that people need, right, to manage health, et cetera. So what is the solution to the fact that a public option is liable to get watered down, which is what happened with the ACA. The one we had wasn't worth having at the end of the process, and very few people knew that, including activists, not just the general public, right? Well, what I think it is this. I think it's a really good idea that Medicare for All is the campaign issue, because that's the platinum plan, right? And that drives the whole debate to the robust, to the bold. But then understand that we probably can't really pass Bernie or Pramila Jayapal's bill after we have a progressive president, a progressive Senate and House, and then we settle for Medicare for America, and so which is the gold plan. And so that gets us much more likely, if that's not your starting point but your end point, you're going to get a much bolder plan that gets us much closer to where we need to go, and then you build on it after that. So I'm going to suggest it's not an either or. It's great to have both out there. Now, there are a couple presidential candidates running on Medicare for America. You'll be very surprised to know which one is explicitly running for Medicare for America, that is actually running on the DeLauro and Chakowski bill. Anyone want to throw out a guess? Just quickly, just popcorn this. Which candidate?
Joe Biden.
Beto O'Rourke is actually running on Medicare for America. Warren does not name it that, but looking at what she says, I think she essentially is. Biden is unclear. It's unclear to me. He's running on a public option. It's unclear if it's a really bad one or one as good as Medicare for America. And so I think a very valuable thing to do with Biden when he comes to our state, because we're a battleground state, is to find out a little more detail on what kind of public option. Can they set the price of medical services like Medicare? That is the key question. Can they set the price or negotiate with pharma, and is there a way to make pharma negotiate if they won't, which you need, like the Doggett bill that I recommended, for example. It looks like Harris and Booker are too, but it's a little less clear to me than it is with Warren and O'Rourke, just for example. And so this is all very interesting. I believe that Mayor Pete is essentially running on it too. I'd put him further along than, say, Biden, but not nearly as clear as O'Rourke or Warren. But he said some pretty strong things that make me think that he's running on at least a decently strong public option. I still think all of them need a lot of questions. I think Elizabeth Warren needs questions. It's interesting that this is the one area where Elizabeth Warren is less specific on policy. So she's now notorious in a good way for having a plan for that, right? There's a plan for that. The one area where she's less fleshed out is healthcare. So when she is here, which I'm sure she will be, it'd be great to ask her. Now, there is a divide kind of in the kind of single-payer community. There are some people who think that it's a sellout to settle for anything other than pure single-payer right away. And that's a realistic perspective. Their position is if you leave the for-profit entities in there, they will, they will undermine and corrupt anything, and that you just have to do away with them. And I'm not arguing against that. I'm just laying that out as a possibility. And therefore, they think Medicare for America is a threat that undermines what we need to do, right? Some of those folks do. And so that's a conversation we have to have. I think if we're going to get to an end game, because we're not passing the Bernie Sanders plan as it is under the best of circumstances, simply because legislative processes change things, right? There's a Senate filibuster, And so we're going to have a negotiation for what's in a plan, even if the pure Medicare for all plan. And we're going to have a movement, a progressive movement, that's willing to take a good deal and not tear ourselves apart over missing one or another thing, right? As long as it's a very good deal. So there's the solemnity prayer that the Alcoholics Anonymous has, which is about knowing what you can't change, knowing what you can change, and the key line is the third, the wisdom to know the difference. We need the wisdom to know the difference and to know what is a really good deal and what is the best we can get, or what is really something where we could have gotten more, right? And to do that together, because since we are outgunned, since there'll be hundreds and hundreds of millions of dollars in the most expertly crafted ads imaginable by Madison Avenue in New York to undermine any such plan, the only way we win is something like the resistance to Trump care, but positive for a bill, right? Way more than we did in ACA. And I think ACA, the problem was in part it was complex and we were conflicted, right? And we thought it was great we were doing something, but my God, are those subsidies really enough? And will people be able to afford it? And those were all quite good questions. But again, it was a huge step forward. And at the end of the day, ACA, not because I think it was brilliantly administered or implemented, but because of what conservatives decided to do is set us up for the next big step in healthcare, because they couldn't get off of it. And despite the polling and the clear evidence that what they were trying to do after Donald Trump was elected, what Paul Ryan and Donald Trump and Mitch McConnell was trying to do was highly unpopular, kept trying to do it. And part of it was, and this is what I want to close on, the public is very, very ambivalent on healthcare. They want better healthcare. Healthcare is very important to them, but they're very afraid of something that might take away what they have. It's a risk. It's like you're in the middle of a pond. You know you have to keep crossing it. You need to jump to another stone, but you could be frozen because you're afraid that you're going to fall in the water and go down the rapids before you get to the next stone, right? And you're looking for one that might be easier to get to, right, along the way that leads you to the stone, and then across the river, so to speak. And so what we've had is, with the Clinton health care plan, the Affordable Care Act, and then Trump care, even though they seem different, the same thing has happened in a lot of ways. That is, each side overinterprets where the public is. So Democrats, when they win an election on health care, overinterpret it and say the public's totally with us on everything, and I can push this through a process with all of these ads on TV, and we'll win because the public's with us. That's an overinterpretation. Or the Republicans, it was a great issue to beat up on President Obama, and we won elections on it, and the public's all upset. Therefore, they hate Obamacare, and therefore, of course, they're going to be with us when we get rid of Obamacare with no alternative, right? And we'll put 30 million people out of insurance, but it's awful, right? And they'll be with us. And they both all overinterpreted, both sides, where the public was. And so we can't win this election and overinterpret where the public is and think that they are for Medicare for all or bust in 2 years, and therefore they'll be with us no matter what, or we'll generate this huge possible backlash. But by the way, if we don't do it, we're underinterpreting the public, right? Because they do want the healthcare system fixed. And they're fundamentally right that it's broken, that it's getting more and more expensive, that it's unsustainable, and that it needs to get fixed, right? And that it should be a right. Record numbers of the American public think it is the role of government to guarantee everyone has affordable health care no matter what. And you know what the problem with conservatives are? They don't want that to be the case. They want to shrink government in a bathtub, and they don't have any solution that would work because you have to use our democratic government. The only people that care about people's right to health care is we the people, through our democracy. There is no market actor that does. There are individuals within the healthcare system that are in the private side that care, but the systems don't. The systems seek money and profit, right? It's why prescription drug companies are willing to have a business model that says we're going to charge way more than we need to maximize profit, because if we made 45%, it's okay to make 50, 55, 60, and Wall Street says to them, you're making 60, why you can't make 70? How about 80? I mean, there's no stopping point, right, from all the financial speculation. And so the only people to say no and to say that medication that is funded by the government to create and research needs to be affordable for people, and you can get a reasonable profit, but not a windfall profit, is us. we the people. And so the reason conservatives have been so adamant in trying to kill it and have run against a brick wall, it really is like, you know, those Civil War kind of scenes where people are dug in and they keep sending waves of troops and they get shot down, they send the next wave and the next wave, is because they can't allow us to establish that this is a role of government in our democracy because it is against their whole approach, their whole vision. Their ideology is not a workable ideology, a governing ideology for guaranteeing people health care. But what's interesting is they run like it is. President Trump in his re-election speech is saying that he's going to provide great health care with a secret plan. Remember he said Mitch McConnell was going to provide a plan? Then Mitch said, no, we don't have a plan. Then he says it's going to be after the election we'll find out the great plan. Well, he had, during the whole Trump care debate, all this time to put out the great plan, and it never came out. And the reason is there is no plan other than us, we the people, restructuring the healthcare system in a smart way, in a way that keeps all the great stuff we have. We need to be mindful. We also need to be aware that a lot of people work in insurance or work in hospital or doctor's office administration, and that actually is going to cause a lot of people to be unemployed. Now, that doesn't mean, don't misunderstand me, therefore we have to eat the current system, but it means we actually have to do a real transition plan for those folks, and we're not talking about that enough on our side, okay? We need on the Green New Deal to do that too for fossil fuel workers, and rightly so. I saw a great article by the head of the flight attendants union. This is on the climate issue, who might be the next president of the AFL-CIO. She's a rising star in the labor movement, who said the reason labor is skeptical in Green New Deal circles of there being a just transition is because there never has been one. And this stuff about we'll give you a little money for job training is not the same thing as giving someone access to a living wage job they're losing. And so not only do we need to do that for the climate transition we need in order to save the planet, quite frankly, not the planet. Actually, the planet will be fine. It's the human species that'll be in trouble, okay? The planet will go on. But we need to do that in healthcare as well. And so we need to put a bunch of money into a just transition. There are lots of things these folks can do. These are highly skilled people. We can't have this situation that if you don't have claims for you to deny, then there's nothing for you to do in our society. I'm sure that takes a lot of accounting skill that can be used for other purposes, right? Very effectively if we make that investment. So my close is that we're on this brink of potentially actually achieving healthcare as a public good. Healthcare is a right. Health is something that's guaranteed by our democracy. It's going to be, we have to win this election. We have to win it in part on this issue. And then we have to win the end game in a legislative fight once we have a president who wants to fight for this. And we have to be willing to understand what a good deal is and understand if we are able to take a step 3/4 of the way there, we need to be willing to do it. But we have to understand that we are taking on a lot of money, a lot of influence, that in many ways this is a battle for the ability of our own democracy to solve our biggest problems and to achieve the fondest hopes and aspirations of our people. This is one of the biggest tests of our experiment in large-scale small-r Republican government, frankly, in the last 250 years or so. It really is. Because we have a whole new 21st century. We need to replan our economy to prevent a climate genocide. It's going to require a more effective democracy we've ever had. And to do that, we can't have the folks in charge who want to destroy the power of government to do anything and to simply outsource everything to the highest bidder. And so with that, we have a great opportunity, but we have a huge responsibility to do this well and to do it right. So with that, I would like to have Shirley say a few words, then we'll have questions.
Thank you. So, can everybody hear me? Yeah, okay. Because I just ignore microphones and things. So I wanted to say that on the seats around you, there are these sheets, and I'm hoping everybody will take one home. And it's two-sided, which is not obvious. And it lists the events that Keith was mentioning earlier, all of them that are short-term and coming up in June, as well as others in July, August, and even September. So I hope you'll take it with you and refer to it and put it in your calendar and just be aware of some of the things that are coming up. Now, there was one thing that isn't listed on here that I did want to mention, and that is that Grassroots North Shore has instituted some training for what we call deep canvassing, which means going out into the community and talking to people and finding out what their issues are and what they're happy or upset about, and how to talk to them so that we have a long-term base that we can work from in different communities. And so there's training for that next Sunday, no, the 30th, next Sunday. And then there'll be there'll be canvassing after that. So you can find out about that on our website. And Nancy Kaplan also is out there if you want to ask her questions about it. And she can give you more details. Speaking of more details, there's a mention here for next Saturday of calling and canvassing. The canvassing is in Whitefish Bay. The calling goes to the Bayside, and that's at my house. And on this sheet, it has my email address. So anybody who wants to participate can email me, and we can start a conversation about it. I guess the last thing I wanted to mention is that Dan Folkman is still set up for, yes, he's the one with the gold sash, so you can find him. He's set up so that he can take more videos on healthcare stories if anybody else wants to participate in that. And then that'll be used in a variety of ways, including giving it back to Citizen Action. Yes?
What about the book club and the color ball?
Okay, so the last event that we had was with Reggie Jackson, and he talked about the government pushed segregation after World War II, and there's a very well-known book called The Color of Law about just that, and it's really a fascinating book. If you are interested in that, there are multiple copies available through the library system, and we've set up so far a book club meeting on August 1st. We haven't decided whether it's in the afternoon or the early evening. I'm leaving that up to the people who are participating. I'm the person who's going to run it because I've taught English for a long time, and it just seems like a logical extension. But anybody who wants to participate in that should also email me at the email address on here, and I'd be happy to tell you more about it. The book was astonishing and surprising, and very necessary, I think, for a lot of us to understand the conversations that are really going on. So I handed out little cards to people when they came in for them to ask questions. If you can pass them, toward the centers or something, we'll collect them and read them off. And then any time that's left after that, we'll just take questions from the floor.
And so, by the way, you obviously, if you haven't already, please join Grassroots North Shore. And if you already have, or you do now, you can also join one of our organizing co-ops in our Medicare for All, our Healthcare for All co-op, which Karen Kirsch here leads, is something you can join. And we are also working directly on Medicare for All. In fact, we took a group down to Chicago to have a rally to try to encourage the AMA convention to support Medicare for All. And it actually came within a couple votes of passing, which tells you that, and that's not where the AMA was 40 years ago. So a lot of doctors think the whole system needs to be transformed as well. It's a close vote now, which it wouldn't have been even a decade ago.
Or do you want me to try interpreting them?
Let's see, I will.
Make your best guess.
Okay, how will Medicare for All be paid for? So that's a great question.
You said it's not paid.
So I'll explain. The two bills in Congress, that is Bernie Sanders' bill and Pramila Jayapal's bill, and another very known bill, a single-payer bill that was in California last session that played a huge role in the governor's race in the election of Gavin Newsom. They don't have a funding mechanism at all because the authors decided they wanted to kick that can down the road. The problem is, if you're going to talk about an income tax that covers $30 trillion, that's going to be a big part of the debate. So I can see why they'd want to do that. Their concern is that all the Republicans will do is talk about the biggest tax increase in the history of the universe, right? Which it might be, actually. And they'll miss the point that people would pay less. So do you want to pay more but pay directly to insurance companies, or have lower wages? You want to pay less through a tax. Republicans would say a tax is so much worse, you'd rather pay the cable company double. I don't personally agree with that, but that is the philosophy out there. So they kick that down to a legislative process, which tells you how hard it's going to be. One of the things I like about the Medicare for America bill, which is a universal health care plan, is the very robust public option is it's paid for. And it's paid for by the Trump tax cut, taking it back. It is paid for by keeping employers paying into the system a lesser amount and keeping states paying for Medicaid, but instead paying for this, the new Medicare for All system, for their piece of it, for low-income folks who are on Medicaid. And so it also, frankly, when Vermont, did you remember Vermont passed a single-payer plan a few years ago? And I know the person who tried to create it, and now they run their health insurance exchange. They found out that the payroll tax they'd have to have on the employee and the employer both was so high that even Vermont couldn't stomach it. And part of the problem was that a state can't claim the savings. Okay, there are savings you could claim and put into the system to finance it. A state doesn't have that capacity, so the state has to pay all the costs, gets none of the savings. There's actually an interesting thing on the National Democratic Platform, the Democratic Party. I was on the platform committee for Bernie Sanders, and as you might expect, the single-payer resolution sponsored by Bernie Sanders did not succeed. Hillary Clinton and the DNC delegates voted it down, the ones that were put on there by the Democratic National Committee. But I had a amendment that was supported by Bernie. It was one of Bernie's 30 priority amendments, which allowed states to do single-payer Medicare for all and to capture all the savings from doing so, have the federal government assist them. And Hillary's folks signed off on that with a negotiation. I'll tell you the story. What I was told by Neera Tanden, her negotiator, the head of the Center for American Progress, was Hillary doesn't like the words Medicare for all and single payer. If you remove those words and call it universal health care, then it can be in the platform with her support. If you don't do that, you can have your debate and we'll vote it down, your choice. I said, I'll take it in the platform. So they just said, done. So that it got in the platform. So interestingly enough, that's another possible approach, is to empower states to do single-payer plans, which is another possible fallback if for some reason we can't get a full national plan through in 2021. Let's say, it depends, the candidates are differing about the filibuster. Like Elizabeth Warren said she'd get rid of the filibuster. Biden is not clear whether he would get rid of the filibuster, just for example. It's not even clear Bernie Sanders would, interestingly enough. And so I know that people's positions will evolve during these debates that start next week that you'll all be watching at Grassroots North Shore events around the area. But I'm saying that there's a lot that can go on in this endgame. So you probably would pay for it. I mean, it seems like where Senator Sanders is going is you would have something broad-based and progressive like an income tax, but then you do have the liability of having a seemingly gigantic income tax increase. But that's probably where they're going, but it's not in the plans. So, next question is, what can be done to reinstate Fed funds for reproductive health for females that include abortion? Well, we got to keep fighting on that. Planned Parenthood, our close allies, is doing a fantastic job. Unfortunately, it's very much like Trump care. They're just, every time you think they're more extreme than you can imagine, they get more extreme, right? So what's happening in Missouri and Alabama, other parts of the South is unbelievable. And we just got to keep fighting that this is women's health. And it really is a freedom issue because it's okay to have moral disagreements, right? To have a moral position, but we impose it on everyone else in a democracy when there is moral disagreement on something and there's no scientific proof of the claims they claim. They make all sorts of false claims about the science. Obviously, it should not be something that where you have one side of a moral position impose their will on everyone else. And there's also, quite frankly, I have trouble believing this is, since all the sanction is focused on the women, right? And it does take two people, right, to have this situation, that this really is kind of a traditional kind of sexism involved here and controlling women, and that it's women's fault when there's an unplanned pregnancy, right? And then, of course, taking all of the resources away from the women to actually have planned pregnancy, Planned Parenthood, right, by definition. So I think that this U.S. Supreme Court is dangerous because and the state Supreme Court, were anyone surprised that the state Supreme Court upheld the lame duck? Does anyone think that same state Supreme Court wouldn't have struck down the lame duck if the lame duck bills were done by a Democratic legislature and governor? Any doubt? So what does that mean? They're politicians in robes, and they're pretending to faithfully interpret some kind of fundamental law. Anyway, so we have to keep fighting, and those forces need to get defeated. Do you have?
I don't know how many people around here have an interest in watching C-SPAN, but I do that a lot. And there was a fantastic program on last night and it was an all-day event by Planned Parenthood. It was interviews of all the men and women, all the candidates, so, whatever the number that are running now, the 22 members.
Yes.
And every one of these guys, they were all talking to the women and the men, but there were plenty of women to be talking, and it was terrific. I highly recommend it if anybody, wants to check it out.
Yeah, and C-SPAN is a good website. You can go search for things and rewatch that. So that's a great idea. Someone wants to know if there are downsides to Medicaid expansion and what motivates the Republicans. Good question. Are there downsides and what motivates the Republicans on this, on Medicaid expansion, on expanding our Badger Care program? Surprisingly, and this should call into question anyone who thinks that we just need easy lifts and then we can have bipartisan cooperation, okay? This is as no-brainer as you're ever going to have. Yeah. We are spending a lot more money to cover fewer people, period. And the reason we're doing it is for political and ideological reasons. We started doing it because Scott Walker thought he needed to be against the Affordable Care Act and all its aspects to become president. We saw how well that all went, but and we've spent over $1 billion for his presidential ambitions. Now Robin Vos thinks this is the positioning to have in order for him to become governor and to be Republican nominee in 2022. And the problem is that at least when Walker did it, as bad as immoral as it was, because people are dying because of this, and we think we could do with an extra $1 billion in terms of investing in our education system, our state infrastructure, anything else, right? It's just amazing, right? But these are the folks that want to damage and destroy the capacity of government to do things, so it makes a little sense to them, right? A little more sense. But frankly, when Walker did it, at least the ACA was seemingly unpopular and the Republicans are winning elections on this issue. Vos has now done it after 2018 and what's happening in 2020, and it's because their betters, in DC or the Koch brother and Bradley Foundation types have not come up with a new paradigm on healthcare. And you see that with Trump as well. And so Robin Vos is on the old playbook, which is why Tony Evers should not give in, right? But by the way, it's worth spending more money to cover people. So we can't ever lull to sleep that believing them that it's about, that's just too expensive. Well, when it's cheaper to cover people and you're giving them money away in order to not cover them, they still want to do it, right? You'll notice that. And it tells you how powerful the motivation is to not admit that we need to use our own democracy to guarantee health care. I mean, upper middle class people can't afford health care on their own. Why do they think a cashier or a waitress can? Right? Who by no fault of their own, maybe working 2-3 jobs, is not offered good health insurance at work. A Wall Street broker gets great health insurance, doesn't have to worry. So the employer-based system is highly regressive. The people who need the health care the most, who have the least resources, are the ones who have to pay the most to get it. I mean, it's outrageous. And they say, it's all taking place on the marketplace, not mentioning the fact they've been trying to repeal the Affordable Care Act, and they have a lawsuit By the way, the oral arguments for Texas v. Azor, the lawsuit to take out the ACA and re-legalize pre-existing condition discrimination and all the rest, is July 9th. We'll be alerting you of events and actions we're going to be taking. Karen will, so stay tuned. But why would they do that? And Trump has been all over TV. He was on this morning again with his Chuck Todd interview. He's always been protecting people with pre-existing conditions, and all the Republicans are. Well, why did they try to take away the protection? And why is his administration arguing that in the Texas case, in their brief, that the Supreme Court should take out the whole law, lock, stock, and barrel, all of it? But then he didn't say leave pre-existing conditions alone. His Justice Department isn't saying that. I guess which Attorney General is pushing that? That great Attorney General, Mr. Barr. Yeah.
I just one thought. At the end of what you were talking about, I was thinking about how do you get the individuals in the Senate and the House on the Republican side to come along? Because I started thinking about the time at the end of after the Affordable Care Act was in process, it was, remember, there was complaints forever, for months. It went on for six months, or almost 6 years, complaining about it. How do the issue becomes, everybody's going to want to be the one that gets the names recognition. That's one of the issues, because what was happening after Americans began to understand what was possible, that's when people finally were saying, they never did any advertising. What the hell was wrong with them? They didn't do any advertising. Well, they didn't. That's true. So that's a part of it that really can't overlook.
So I take this next question as, how do we persuade the other side, educate the public about why Medicare for All is a good idea? Well, there's a difference between the public, where you can make a certain case, and the opposition, some of which will believe any fact that supports their position, and will grasp it and will resist any fact that doesn't. And it's interesting, we tend to assume as progressives, because we come out of the Enlightenment and we think more education always makes people smarter and better. The cognitive researchers have a term called brilliant idiots. And what it refers to is the most difficult people to persuade on the other side, the right, are the people who are better educated and know more, because they're more able to develop facts to justify their position. So try listening to right-wing radio, not as some kind of philosophy seminar where they're trying to provide reasons, but as literally hour after hour of rationalization for what people want to believe. Right-wingers want to believe, because that's what they are. And the better educated they are, the more able they are to grab the facts. So you'll notice on Medicaid expansion, Badger Care expansion in Wisconsin, right? We know the national research says, overwhelmingly, that it actually lowers the cost of private insurance, because right now, only the most motivated people with health conditions are signing up for the marketplace at that income level because they have to, because they have cancer, and so they're willing to pay more than they should for their health care to hold on to it, and the healthy people are the ones not signing up. And so if you expand Medicaid, make Badger Care eligibility higher, it actually takes out a lot of people with health conditions out of private health insurance and lowers costs 7 to 12%. But lo and behold, this study funded by the Koch brothers, funded research group, came out right before the Republicans started working on their budget, saying it's going to increase cost. And it was debunked by both public health professors at UW and then by other professors at the Research Institute that put it out, let alone all the other national research. But if you listen to Alberta Darling, are we in Alberta's district right now? I assume we are. She just keeps repeating that it's going to increase the cost of insurance and health care for everyone over and over, because she needs her little fact and she's going to repeat it no matter what, and they're willing to say anything. So there's no persuading her, because the evidence, doctors have gone to her office, and I've worked with some of them on talking points, and laid all this out to her, and then the emails come out the next week and she's repeating something they know is false. And then people who are then kind of 20% Trump base will believe that because they want to believe it, right? And grasp onto it. So is there any persuading Vicki McKenna or Mark Belling or any of these folks? Dan O'Donnell? No, these are the right-wing talk shows. No, there is not, because they will just grasp onto whatever works. Now, for the public, therefore, they just have to be beaten, unfortunately. I know that sounds very undemocratic and unfriendly, but when people are impervious to reason, will make things up, and will do things that damage the public interest tremendously like this, you just have to defeat them in the legislature and elections, right? They don't want them to. We're not like the divisions we see, we're more afraid of, like anything needs to be done to them other than not hold office, right? So that we can get done the public business. They can go on to other exceptional careers, hopefully publicly beneficial, right? So we wish them no ill will other than not to be able to damage our healthcare system by having a vote in the state legislature or as a governor, etc. Now, with the public, you have to talk in terms of their core fundamental values. We progressives, activists, are so into the facts that we overuse the facts, right? And we need to know them. But then people like sports cars, not because they know all of the complexity of how they work, because they just like, they're cool, and you see the part you need to see, right? And how fast they are, and you experience it, right? So for healthcare, it is, first of all, to prime them what they don't like about healthcare. What people don't, and the core issue is pre-existing condition discrimination, not because insurance regulation is the be-all and end-all, but because it invokes this great moral outrage that a for-profit actor would take away your health care for profit when you need it most, when you have a cancer diagnosis. That a woman gets a breast cancer diagnosis, and then an insurance company runs an algorithm that then leads to a fraud investigation and then removes her coverage right before she needs cancer treatment, and then risks her whole family, her kids' college education, everything, to throw them off and not have to pay. That's what we're talking about, right? And that's true across the system. That's true of a medication when you raise the price of a medication by tenfold and people can't afford it. It upsets people. So we remind them of that, and then we talk about the only way to solve this problem, and we should focus on the private actors that are responsible. So we don't want to bash all medical professionals or doctors, but if certain doctors are doing something, right, then they obviously can be mentioned, just for example. Just like the pharmaceutical manufacturers. I'm not, at least right now, trying to socialize them. I just think they should just be able to make a reasonable, decent profit when they're in the healthcare business, the life and death business. The idea that I have a right to 90% profits in that sort of setup when it's life and death for people is immoral and not reasonable at all. And so then say that's why we need our democracy to step in and guarantee everyone has affordable health care no matter what. And that is an 80-20 issue. And so remind them what upsets them, then explain to them how we're going to empower them and set them free and make sure that healthcare decisions really are between doctors and patients and their families, which is all people really want. It's a really simple kind of thing. It's a reasonable request. Let me just run through these quick, then I know someone has their hand up as well, but I'll get through the ones that were written, then we'll do that. Malpractice insurance, driving up costs. Fact is, it's a much less big part of the cost than most people think. I understand why it's upsetting to doctors, because getting sued is no fun. You know, I haven't been sued, and I hope we don't ever get sued, right? But it's a kind of scary proposition. In Wisconsin, we have very low medical malpractice caps. And they're so low, in fact, that the Patient Compensation Fund has over $1 billion in reserves in it. So it's not a major part of healthcare costs in Wisconsin. But if you want to make it part of reform, that's fine. But if you want to be a conservative legislator and claim it's the problem, and we just go after the trial lawyers and that fixes our healthcare system, that's just not true. So I'm not saying it's not a problem at all anywhere, but I'm saying it is not the reason healthcare costs are double per capita what they are here versus anywhere in the world. Next one is, let's see. This is one about Medicare for America and paying into the system. Who wrote this one? Maybe they can, I can't quite interpret it.
My handwriting is notoriously bad.
Okay.
So my question was, if we were to keep the current Medicare arrangement, which most of us here have experience with, and we all know that we pay a certain amount in, if we kept that system where we're all paying in a certain amount, and then we extended it so that the people who were getting the subsidies were the people who needed it most and not everybody, wouldn't that just take care of it economically?
Take care of the alleged shortfall in the Medicare system as it is now?
Right. So in other words, people who could pay and then who couldn't.
Or you simply raise the amount that people pay who are very wealthy, right, that make $200,000 or more, whatever, wherever you want to set it. There are all sorts of ways to make Medicare sustainable as it is, just talking about Medicare as it is, not Medicare for all, right? By the way, just the way actuarial science works, Medicare has always been 5 to 10 years away from bankruptcy, the whole history of the program. So to some degree, when a politician uses that on you, they're just fear-mongering. But the other level, there really could be an issue that we should deal with. There are all sorts of financing mechanisms that make sure people best able to pay or could take care of it. And the idea that we need to cut benefits or not let people get it until they're in their 70s. The problem with that is, quite frankly, that what are the chances someone there can keep a good insurance at work that whole period? It's less and less. So there's no real crisis that means, like Paul Ryan thinks, that we need to go after quote-unquote entitlements, because we actually need Medicare, something closer to Medicare for all, rather than going after the Medicare for all we already have for people over 65, or for almost all, right, and for people with disabilities, right? So I think it's what you suggest. I haven't run the numbers, but there are a lot of other ways to not have any problem there. And remember, Ryan's plan was to hand over to private insurance, which would cost double as much. So he wasn't even about trying to make it affordable. He was about undermining government and privatizing it so we could have more profit, period. Because Ayn Rand said you should when he was a kid. He read all of her books, apparently. Is it true that 180,000 to 600,000 people file for bankruptcy for medical bills each year? Yeah, probably more. And increasingly, it's people who are already insured. And there's a real problem here. The Republicans just like to look at the number of uninsured people. Ron Johnson says, why are we trying to change the whole system for, the 12% who aren't insured? Well, first of all, it suggests that it's the same 12% and people aren't uninsured a lot of different people who cycle through. But second, it ignores the fact that the employer response to these 10, 12% increases every year for health care has been to shift more and more costs onto the employee and to cheapen out the plans and to create holes. Remember the whole George W. Bush strategy, the high deductible health plan with health savings accounts? We got the high deductibles. We didn't get much of the health savings accounts, which have mostly become a tax dodge for wealthier taxpayers, as predicted at the time, by the way. And so at the end of the day, we're having a situation where being insured is not enough anymore, because and in fact, a lot of what Trump wants to do when he allowed these short-term plans to be 363-day plans, so that you could have them all but one day in the year. What better, more flexible plans they are? They talk about flexibility and just the health care you need. Well, these are the health policies that don't have that unnecessary cancer coverage when you don't have cancer and things like that. So they're like junk insurance. And a lot of the conservative plans for health care are to allow people to buy junk insurance with a lower premium. Of course it's lower, but then it's like I'll give you a lower priced car, but guess what? You might fall on the highway. That's literally what we're talking about here, right? I know you had a question, sir.
Yeah, I didn't write it out because it's relatively complicated. So, currently the U.S. population has 3 different federally funded or partially federally funded healthcare plans. We have Medicaid, which is programs funded by both the federal government and the states in shared relationships. Then there's Medicare, and lastly there's the VA system. And if you look at Medicare as it is now, I think you were alluding to that in your unreadable question. It has costs associated with it that can also bankrupt older people. because there are donut holes for pharmacy coverage. The list goes on and on. It is far from an ideal health plan. It's nothing like universal health care in any other developed country. So what I don't understand in the conversation is, why are we hung up on Medicare for all when across the world there are so many different examples of modern countries that provide high quality, good health care in different models. For example, in Germany, they have a private health insurance industry. Everyone gets their insurance through private health insurance companies that compete with each other, but it's mandated, and everyone has wage deductions that go to cover that. In other countries, like in Canada, there isn't a Canadian healthcare system. There are Canadian provincial healthcare systems.
Yep.
Each province is responsible for providing health care to their citizens. So why are we stuck on arguing about what's clearly like a very dysfunctional, of course, because it's an American plan, that when it comes to health care, all of our recommendations are dysfunctional. Why do we want to try to sell the public on adopting Medicare for all when it is like so not perfect and will, much like Obamacare, the Affordable Care Act, will lead to people complaining about it, being unhappy about it, when there are so many other good options out there. So, and lastly, when you look at almost all the other modern countries that do have some sort of mandated health care, people buy private insurance on top of it. So many Canadians have private insurance on top of their provincial health care plan. Australians have private insurance on top of their also statewide, they call them states there, statewide health care. Why are we stuck on Medicare for all? I think it's like a failed idea.
Okay, so you're completely right that Medicare for all, defined as single-payer Canadian style, is not the model in a lot of other Western advanced countries. It is in some others, but not every single one. And some of them, like Germany and Switzerland, have private insurance systems. They're nonprofit, but have those systems. You're completely right about that. I think that it is progressive activists who are focused on it must be a Canadian-style single-payer plan. It is not the public, as I was describing earlier. For the public, Medicare for All is a brand that's a very broad brand, and they would probably consider these other systems in other countries to also be included. They just think Medicare for All means the government's guaranteeing I have access to affordable health care as a right, okay? So the public's not fixated on Canadian-style single-payer. Progressive activists are, and it's an open question. The dilemma is this. By the way, all of these plans are improved Medicare that fill in the holes, right, that you just talked about, right, including Medicare for America. So they're not the same, but they're the same brand. In fact, when Leah Vukmir kept attacking Tammy Baldwin for abolishing Medicare, do you all remember that in the debates? She kept saying it over and over again, and Tammy just kept ignoring her. And then Tammy said, you know, eventually Tammy just said, and got laughter at the end of one of the debates, well, apparently to Leah Vukmir, expanding Medicare is abolishing Medicare. And everyone just laughed, right? But bizarrely, Leah Vukmir was right legislatively. These bills do away with the current Medicare program and create a new system. So they do technically repeal Medicare. They just replace it with something that's Medicare plus, right? To say the least. So she was technically right, but she was acting more like a progressive. Those sort of legislative details don't matter to voters, right? If you're building a Medicare for all plan, of course you're not banning Medicare. It makes no sense, right, to the general public. So the question, though, is this. I've heard some really good single-payer advocates talk about this, and in fact, in some of the hearings that have gone on in the last 2 months in Washington. Could you train our insurance industry to have a better business model? Or would putting them in the middle lead to them simply particularly since they're all Wall Street traded companies, right, with the worst of Wall Street practices, would they not find ways to try to to only insure healthy people and deny claims, whether it's in the public interest or the interest of health or not? And the ACA is not a good example. They have continued to try to find ways to go back to their own business model. When given the opportunity to have a new business model, most of them have not taken it. So that's the question. The Germans, nonprofit insurance companies, have a tradition of not acting that way and are institutionally structured that way. I don't know if you can cure United Healthcare, for example, of their approach, right? So that's the question. And then the question is, really the debate over Medicare for America versus Medicare for All is whether you have a mixed system with a really strong Medicare component that anyone can choose, or whether you're just going to have one single public system. And so that is kind of a choice that's different. Another thing you should know is that this is something to know about them being a platinum standard, and I'm not making it up. The Pramila Jayapal bill in the House and the Bernie Sanders bill in the Senate is better coverage at lower cost than any system in the world. In other words, it has no copays and deductibles. There is no other system like that. So you do have to question whether the United States could go from what we have to having by far the most liberal system easily compared to anyone, or not in one step. I mean, that is I'd be all for it. It'd be great. I mean, I'm for America leading the way on progressive reform. Believe you me. But there's a question. There will be a question of end games. So I think I take your point that, and I don't think it's a problem with the public because they see Medicare as a broad, flexible brand. I think it is a problem that some progressives are so committed to Canadian-style single-payer is the solution, that it may be a problem with some of them accepting, 3/4 of a loaf, right? And again, for 3/4 of a loaf, I'm only for it if we make it clear that there's another quarter to get, and don't claim this is the end, we have the perfect system, right? After let's say, President Bernie Sanders or President Elizabeth Warren passes a great health care bill in her first or his first 200 days, just for example. Let's get the best darn thing we can get, the biggest advance we can get, that then sets us up hopefully for whatever's left after that, whatever chunk we're not able to get at that point. Yes?
I wanted to bring up the fact that nobody's made a comparison between TRICARE for the military and Medicare, which TRICARE was invented a little bit after Medicare, and that's a more recent national health care program for the armed forces who retire from their division in the Department of Defense. And I am raising this question that we really need to look at all of these different programs that the government has and make a comparison to get at the best for everybody. So, and federal retirees get Medicare Plus. The government subsidizes their private insurance and provides them with the prescription drugs with no donut hole whatsoever, and has a much better program, which is exactly like what the congressional folks get as our servants in Washington. They are making sure that federal employees have a very good program, but the general public is not factored into this, and we've got to bring it all together to have a much better program.
So I think that the policy folks who are actually drafting the bills are looking at TRICARE and the TRICARE situation. For the public, they just know Medicare as the brand. So talking to general disengaged voters, it doesn't, unless they happen to be someone who has experienced TRICARE or a family, then it's worth talking about. It doesn't necessarily help explain it to them. I mean, Medicare for All in many ways, it's the way we explain unfamiliar things to people is through metaphor, right? That's why we call something the war on poverty, right? We're using war, something clear, to describe something different. So Medicare for All could also be seen kind of as a metaphor that we're using with the public in order to explain what kind of thing we're offering them, right? Because it's something they at least have some familiarity with. And one thing you can work with us on, we want to try to make sure that the entire congressional delegation in Wisconsin we understand only the Democrats are open, supports hopefully both Medicare for All and Medicare for America, because as I pointed out, Medicare for All, it's important to have the platinum standard out there and to campaign on it. At this point, Pocan is sponsoring Medicare for All, the Pramila Jayapal bill. Gwen Moore is sponsoring Medicare for America. She's a co-sponsor. We want her to do both, but she has not agreed to do that yet. We're still talking to her. And Ron Kind is co-sponsored neither. And we are actually building a whole new organizing co-op in his whole district, the driftless area of his district, so we're going to be having that conversation with Congressman Kind. And we're going to a bunch of legislators involved in lobbying members of Congress on this so that legislators also support something, even if they can't do it with Robin Voss and Scott Fitzgerald, something bolder than Medicaid expansion, which is obviously just so obvious it's not the be-all and end-all. It's just something we should have done a long time ago, and it's great. It's the biggest advance we can make now, but that's not the whole of healthcare reform, right? It's just the obvious thing we should be doing.